All right, and welcome to another episode of our podcast. My name is David Levine, founder and CEO of ResTech Solutions. Today, we are talking about rethinking healthcare going into 2026, a fresh approach to the challenges with patient care. And I'd like to welcome our guest today. Her name's Tao. And Tao, if you'd like to introduce yourself.
Thank you very much, David. Tao Gazarian. I'm with PhrenTech. We're building a mental health VR platform.
Let's go ahead and dive right into our first question for today's topic. So, as healthcare is continuing to evolve going into the new year in 2026, how do you see technology reshaping patient care and the connection between providers and patients?
I think that's a wonderful question. I think the landscape of the medical industry is changing, especially with AI advances. A lot more practitioners are enabling AI in their practices. And I think it's going to have more of a stronghold going into 2026. And I think it's going to be more patient centered. Since people are already utilizing AI, different chatbots to better understand their own personal health journey, I think we're going to see a lot more of that. And practitioners understanding that it needs to be more patient centered.
And actually, kind of speaking of AI, because I've talked with several, and I've kind of seen people go on one side or the other with it. Because I know there's been a lot of concern with the confidentiality of what data may get shared with AI. So I guess what are your thoughts, or how do you see that being addressed as it becomes used more and more in the space?
Yeah, absolutely. I think that the medical industry needs to just be more conscious and proactive about it. People are going to utilize AI for their health purposes, whether they like it or not. They're using it for relationship advice, so that's mental health right there. They're using it to advise on which medications to take, even natural supplements. So I think the medical community needs to get ahead of that and create platforms themselves that leverage AI in an ethical fashion that can deliver patient appropriate medically led advice. So it's if they it's gonna be here to stay, and people are going to continue using it. So I think they just really need to take a part in that and develop their own guardrails and platforms to streamline the type of information that perhaps gets to the patient so they're getting the best care.
I appreciate that. So, kind of getting into a little bit more about your business. So, can you tell us more about FriendTech and what inspired you to start it, and what problems are you most focused on solving right now?
Great, thank you. FriendTech came out of my own personal need. I've, gone to therapy myself. I see the advantages of mental health care. I see mental health care as something you should do regularly. I think everyone should have access to it, much like going to a primary physician. We take care of our bodies. We should could also take care of our minds. And I feel like, and it's statistically shown that we do have a high rate in the United States of undiagnosed and untreated mental health illnesses. And it is a problem in adolescents as well. They're spending a lot more time online. And I thought it would be great to be able to provide a platform that entices people to want to seek mental health and in a way that delivers a multitude of modalities that may not be readily accessible to them, whether for personal cost or rural access, not being able to access therapy in person, for instance. And we have seen telehealth make great strides for mental health, and we've seen the benefits of that and people having more access. And so I really wanted to expand that access and build a different way of experiencing therapy and providing the kind of world where you have the telehealth and the in-person coming together in a virtual reality setting. Because statistics also show that the data shows that in-person does have a much better effect, especially when you're doing DBT or CBT. So I wanted to try to replicate that within a virtual reality environment.
Okay. And for those who may be looking for a little more clarity, can you give us a little more insight into, I guess, the platform that you've created and are offering?
Yes, absolutely. So you'll be able to visit with your practitioner, your mental health practitioner, within any type of environment you like. If you feel more comfortable visiting with a therapist in a beach setting or a forced, solitude setting, then you'll be able to do that. We really want to give people different ways to experience therapy and remove the stigma associated with it. It doesn't have to be the white walls and the sanitary, sanitized version of therapy. There are so many ways that people can get the help that they need. And we're all different. You have neurotypicals, neurodivergence. I know a lot of people are seeing those hashtags and, going around on TikTok, and people are more vocal about their own personal challenges these days, which I think is very important. So I also think that we need to start moving forward and understanding different ways that we can deliver mental health. And that includes virtual reality. A lot of people that I know are utilizing it already. It's becoming more mainstream. And as it becomes more mainstream, then more people will be also be able to have better access to mental health care.
Can you actually get immersed in like true VR and interact in that manner?
Absolutely. So there are different ways that you can approach it. It really depends on your comfort levels. You can meet with an avatar version of your psychologist or your mental health therapist, for instance, or you can have them video streamed within your environment. So it does feel more first person and personalized in that sense. So you really get to decide how that's delivered to you. Not everyone has the same VR capabilities as well. So we wanted to also make it cross platform for that purpose. So we are going to deliver a couple of different ways that someone can access the care within the virtual reality setting.
All right, and so I've also noticed that you've worked across multiple markets and industries. So how does that diverse background influence how you're approaching the innovation and leadership at FrenTech?
Oh, great. Thank you. So, my background, I studied behavioral science. I had every intention before I got into software and to go into mental health practice. I was studying to be a mental health professional myself. And then I segued into software. And so I went from trying to understand, the human mind to what drives a machine, for instance, and software and getting into AI. So, being able to meld those worlds together has been also a passion project. I've always been passionate about helping people and the mental health, progress we can make in our society because it's so super important. You really do need to take care of mind, body, and soul. So having that holistic approach and being able to also integrate my sales experience and having executive experience in that in those layered aspects of software sales, I think will do well for me to be able to push this initiative along.
No, that sounds great. And kind of more about yourself. So, what part of your role do you enjoy the most? Is it more the creative side, leading teams, or having seeing your ideas actually come to life?
God, seeing my ideas come to life is a big one. Yeah. I've been dreaming since I was a kid of building, innovating. I first started off in college doing electrical engineering. So I've always really been on that track of just creating and building something. Oh, and that's one of the reasons why I'm so excited that AI has given me the ability to even take part in it. My partner is the highly technical one that actually builds the code base, but I've been able to vibe code and give my input and really strategize, on my time and not have to wait on anyone else and just really build out some aspects of our platform to really make the vision a reality. And that's been really the best part. And eventually when our team grows, right now it's a small team, but as we get bigger, being able to lead others on the same track of wanting to help others, and hopefully they share the passion as well of wanting to be able to expand the mental health, resources that people have access to.
And are there currently any exciting projects or initiatives that y'all are currently working on that you're excited about or very proud of the work that's going on currently?
Yeah. FriendTech is an ongoing project. It's a really heavy lifting, type of platform. So we've been working hard on it since last year. We're still a new company, and we do want to get it right. So we've really been focused on that. But in the interim, we also wanted to provide other avenues and not have people have to wait for specialized care, for instance. There's not a lot of bandwidth in the mental health profession. If you speak to any mental health professional, they'll tell you their schedules are always booked. There aren't enough mental health professionals for everyone to be seen. So we also are working on an AI leverage type of application to kind of help streamline that. When, to kind of give triage and tiered care while you're waiting for your mental health professional. So you're able to talk to someone, even if it's not the not the human form that you might expect, but people have found great help in utilizing ChatGPT, for instance, and getting advice. So we want to ensure that it's done ethically as well, and putting in HIPAA compliance and ensuring that there are guardrails in place, and that the language model that we're utilizing incorporates best practices and languages that mental health professionals would also use. So we do have consultants and for that as well. So we can try to, I guess, create a bridge, from where we are now to the next step, because it's all an evolving process when you're trying to bring something new to the market. A lot of people are still new to VR and still new to what's expanding in the mental health profession, especially even with AI. So we're trying to just really get ahead of that ourselves as builders and try to put in those guardrails and HIPAA compliancy with the apps that we're building. So that's something we're doing in interim while the VR is still being built out.
Okay. Yeah, and that was actually going to be kind of my next question because I know, especially with AI being involved, I know a lot of people can sometimes be hesitant, or people may just outright, tell things to an AI platform without realizing how that data may get used. So, is that something you can maybe speak to a little more, or even maybe what would you say to someone who is interested but just has a lot of concerns about AI and what could happen with what they share?
Yeah, that's a great question. I think everyone has a right to be concerned about how their data is shared. I think that is paramount, especially when you're talking about mental health. There's a lot of deep personal things that people do share within sessions, and it's very important for those things to be confidential. And so I do caution people to not use any agent or app and just share and divulge, because a lot of them do have privacy concerns. And so it is important to be wary of that. So that's why we wanted to take a step. And I know some other companies are doing that as well to try to get ahead of it. If you're going to utilize AI, I think it can be a great asset in the interim while you're waiting for a mental health professional to be available. Or maybe you're just having a rough day and you need to let off some steam and vent. But sometimes that venting, you still need it to be private, just like you would want a friend to hold that confidentiality. So that I think is going to be important. And I think more companies are going to start looking at ways to implement that to ensure that patients feel safe with the information they share.
Oh, that sounds great. So I'm kind of actually excited to see where this is going to go because it sounds like it'll be a phenomenal platform for people to use, especially knowing that we do obviously don't have enough professionals in the mental health care space. And so there are a lot of people who probably suffer silently because they don't have a healthy avenue to tap into.
Correct, absolutely. And it really does matter. And there is the underserved communities. Imagine being in a rural community where you don't really have Wi-Fi, you don't really have access. There's so many limitations, but most people have a phone. And so if you can get through people through a device, just even as a phone, and, through their local carriers, et cetera, there are different ways that I think we can start delivering some sort of triage for mental health illness.
No, that sounds great. I really do appreciate all the insight. So, as we're kind of wrapping up here, are there any final thoughts you'd like to share or leave to the audience?
Yeah, I think that people need to, you don't have to be afraid to seek out help. I'm really glad that a lot more people are speaking out about the care that they've received themselves. A lot more men, especially, are becoming more comfortable with sharing that. A lot more people from communities of color, because there's such a long-standing stigma associated with seeking care. And now that the resources are becoming a little bit more readily available, especially because of telehealth and such, I think that this is a great opportunity for people to explore different ways that they can provide ongoing care for themselves, and be an advocate for those around them as well that may need it, but are too afraid to understand how to approach the situation. And so, yeah, that's my final take, is that don't be afraid of AI. Don't be afraid of technology. There are different ways that we can leverage it to help ourselves. And we just need to get ahead of it.
Well, I want to thank you for coming out and sharing all this information today. And for anyone who would like some additional information, we'll have all the info in the chat, ways you can reach out and find out more.
Great. Thank you so much for having me, David.
All right. Well, thank you.
Bye bye.